love and a small token of appreciation, a memento from our side. So before that, let's welcome them with a big round of applause again. Now let's welcome Dr. Priyanka Riker.
वक्रतुण्ड महाकाय प्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा। Now I request
Come on! Where's the hooting?
One more important thing, if branches are there in different states, we are also having 22 branches of All India Occupational Therapy Association in different states. Like in Goa also one branch is there. So it is the duty of all the branch conveners and office bearers to sensitize their members to get enrolled in the National Commission website, as well as find out whether council is functioning or whether any action is going on or not, or whether registration has been started or not, so that it may create some sort of pressure also on them to take up this matter. Sometimes at some places councils are not very active presently. Gradually from chairperson's direction, they are doing so, but still some laziness is there. So by your pressure at the branch level, I think that some action is possible and this registration will be possible. Furthermore, I invite researcher, clinician, academician to explore the use of AI also in occupational therapy. This is the new area. To enhance knowledge, expand services for the community and facilitate data collection, analysis, development of application-based occupational therapy services one another as we move forward a future where occupational therapy continues to empower individuals, communities and societies. With these words, I once again extend my warmest welcome to each one of you. Let the conference be a beacon of knowledge, inspiration and progress. Thank you very much.
Shown by the group of occupational therapists in understanding the work that is going on at Goa Medical College. To be very frank and sincere, I will tell you, I joined Department of Orthopedics somewhere in 1992, and that is a time that we had a section of occupational therapy, one section where we had only 2 occupational therapists. I still remember them. One was Mr. M.K. Ward, the second was Madam Judy Kantim. I don't know whether she is here in the crowd. They used to work day in, day out and treat the patients. It was in 2013 that we thought that occupational therapy has an important role in the rehab of patients' illness. And in this year, we started the College of Occupational Therapy with 10 seats, and today it has grown to 22 seats. We had no postgraduate courses at that time, but in year 2021, we started 2 PG seats in the occupational therapy, and later when I became the Dean Faculty of Medicine, Goa University, we added another 5. So now we have 5 postgraduate seats in occupational therapy. I'm going to add more, and especially when Pankaj said that morning was a great talk on rehab after the head, face, neck surgeries of cancer. It is really a matter of concern, because as a surgeon, I am a surgeon. For us, our best friend is our knife. Then we don't know where we run it. And at the end of the surgery, you live with so many deformities, so many deficits, and so many disfigurements. So here, the occupational therapy on oncology, we want to start PG in occupational therapy in oncology, in Goa Medical College, in the next academic year. And these are all India seats. Anybody who wishes because there is a lot of oncology work goes on. I myself do a lot of, megaprosthesis. I do excisions of the tumors. What is important here is that occupational therapists, I love them because they give life to the patient. They really give life to the patient. It is not easy because many a times after doing a good surgery, a surgeon feels he is on the top of the world and he has no time to talk to the patient. And many a times we have seen iatrogenic equinus deformity, we have seen iatrogenic contractures of the joint, and all this has now disappeared from the Goa Medical College patient care. So they have added one great layer of treatment for the patients. I also wish to create an artificial intelligence, a special skill lab for students of occupational therapy in Goa Medical College. And it will also be utilized by medical students, but we already got a sanction of 20 crores to have what is known as high fidelity, skill lab. And here our students would practice day to day, as this is with your principle here, that is using research for policy and clinical treatment. In fact, we do research to see that the life of the patient improves and that research helps the person or helps the patient. And this research must continue. And in the same stride, we are also putting a research unit for occupational therapy and physiotherapy in Goa Medical College very, very soon. I have my physiotherapy in charge here. She's just giving me a smile, but that will happen very soon. It is very important that we understand that this science of occupational therapy is taken to a different level for altogether benefit of the patient. And in doing so, whatever help is required from my side, Dr. Vivek, I promise you, in presence of all your occupational therapists, it will be extended to you. This should be your biggest award today. Whether you need a best kind of a lab or you need a rehab center, it will be done. And our government, our Honorable Health Minister, today we don't have him with us physically, but he has sent great wishes to all of you. He is a man who has changed the healthcare in the state of Goa, and his healthcare policies are called as Goa model. Now here you will go, if you get a time, you go and please see our PNRC, that is Pediatric Neuro Rehab. And as I was discussing with Jyotika Madam, I said it is so difficult to treat people with neurodevelopmental problems in children. But she told me it is literally easy if you like the subject. I agree with her because children sometimes are so irritable, but if you like them, nothing is difficult. And we have one of the best neuro rehab center in Goa, and it is sponsored by government of Goa. Such things are not seen anywhere else. If you see my medical college, it looks something like better than a private hospital or a corporate hospital. You should visit my super specialty block where government is pouring in money and all the treatment is given free of charge. So as on this date, I promise you the next OTICON, you will see the occupational therapy department to a different level and you will enjoy to see it. With this, I thank you for giving me this opportunity. Thank you.
Therapy students together in one room. So thank you for inviting me to be here. It's exciting to be part of the 62nd Annual National Conference of the All India Occupational Therapists Association, OTICON 2025. And it's wonderful to be here in the beautiful city of Panjim in Goa, my first time in Goa. The World Federation of Occupational Therapists, WFOT, is a federation of 111 regional and national occupational therapy associations. And as President, I bring you greetings from the Board of Directors, and well-wishers from colleagues around the world. The All India Occupational Therapists Association was one of WFOT's 10 founding members back in 1952. Thank you. And you continue to be a very valued member today. Thank you to the association and its leaders over many years for their vision and hard work. Thank you to the Congress organisers, the Goa branch of AOTA. Your efforts are very much appreciated. And thank you for such an excellent venue at Goa Medical College. We have ahead of us a vibrant scientific programme, and the social programme looks very exciting too. Occupational therapists are creative problem solvers. We learn from what is available and have the confidence and ability to adapt and create new evidence-informed and evidence-based practice and research. The Congress theme, Translating Research into Policy and Clinical Practice in Occupational Therapy, challenges us all to think about our practice, education and research.
Healthcare professionals and the general public about the significance of occupational therapy in improving quality of life. Strengthening the role of occupational therapists in disability, inclusion policies under programs like Right of Person with Disabilities Act 2016. As we move forward, I urge all the stakeholders present here, academicians, researchers, clinicians and policymakers to work together to ensure that occupational therapy receives the recognition and institutional support it truly deserves. I assure you that I will advocate for the integration of occupational therapy into national health and disability policies so that your expertise and services can reach those who need them the most. Your dedication, research, and clinical excellence will be instrumental in shaping a more inclusive, healthier, and resilient India. I once again extend my gratitude to All India Occupational Therapy Association for this opportunity and commend on all your relentless efforts in advancing this noble profession. I look forward to the meaningful discussion and resolution that will emerge from this conference. Let us work together to bridge the gap between research policy and practice so that occupational therapy becomes an integral part of India's healthcare landscape. Wishing OTICON 2025 a great success. Thank you. Jai Hind.
Dutta Pandya. Oh, పవర్ఫుల్ డ్యాన్స్ వస్తాం నేను పట్టడం చూద్దాం చెప్తా
So basically, this is for gate correction. There are 3 vibratory points along the medial arch and the transverse arch. So basically, at any point, if the foot is not in proper position, the shoe will vibrate. So it gives a biofeedback that the foot is not in proper position. The minute you keep it in proper position, the vibration stops. So the patient gets to know that okay, now the nail is now the foot is correct. You can move on. And if the foot is up, it will vibrate again. Yes. Proper position. Practically. Yes.
Do you have a patent for it?
So we are planning on getting it. So DY part. Nabi Mumbai. Nehru.
Skeletal pain and ulnar-collateral ligament here, where the therapist is highly extending the thumb in therapeutic setups like pediatrics, having a GED care and all. So we brought this device. It will have sensors and a threshold. So whenever I hyperextend my thumb, it will give me a beat count that I'm hyperextending it, and I should take a rest or a therapeutic technique to relax myself. So that the wrist... Exactly, sir. We brought in a prevention policy.
Not just for wheelchair, you can use it for anything like chair, wheelchair, sofa, anything. So this is for seat there, and if you lift it up, it will go back to side and sit down. So you adapt. Custom made adapted devices for each individual patient. Not scalable sitting is adapted. Sitting is yes, adaptive. For example, patient is having for the patient or fitting. Yes. You already have it, you are upgrading.
So the lesion will be affected for more. So if they are making this problem, that will be only the gross one. Why did you do this research for almost 25 years? And we have developed this app on this concept. So one is access to the understanding and in Indian context. All is how Indians want to
आज आमचो ऑल इंडिया 62nd OTICON कॉन्फरन्स असलो. OTICON म्हणजे ऑक्युपेशनल थेरपिस्ट ऑफ इंडिया, तांचो एन्युअल कॉन्फरन्स. नाव द थीम ऑफ दीस कॉन्फरन्स इज रियली ग्रेट. अँड यू नो की ऑक्युपेशनल थेरपिस्ट हो एक असो हेल्थ केअर वर्कर तो मनशाक लायफ दिता आणि त्याचे लायफ सुधारता. आता आम्ही म्हणतात ऑक्युपेशनल थेरपी सगळ्या फिल्डान लागता. एक म्हणजे इन्क्लुडिंग मेंटल हेल्थ. आता आणि नवीन तयार झाला की मेंटली इल पेशंट्स हांकां सुद्धा ऑक्युपेशनल थेरपीची गरज असता. आणि वी आर ऑल्सो स्टार्टिंग ऑक्युपेशनल थेरपी स्पेशालिटी इन मेंटल हेल्थ. सो द थीम हियर was to use a research for policy and improving clinical care. So what is meant by improving clinical care? की आम्ही खूप फावटी पळयता की पेशंटाक खूप प्रकारची डिसेबिलिटी असता आणि तो आपले डे टू डे लायफ सारखे जगूंक शकना. ताका आमी म्हणटात एक्टिविटीज ऑफ डेली लिव्हिंग. एक्टिविटीज ऑफ डेली लिव्हिंग जर सुधारयतले तुमी जाल्यार अशी एक कॉन्फरन्स आसप आणि तांचे ओपिनियन आसप एकमेकाचे खूप गरजेचे आसा. आणि हेच आता ह्या कॉन्फरन्साक डिस्कस जातले आणि ह्याचे ॲप्लिकेशन आम्ही आमच्या मेडिकल कॉलेजींनी करतले आणि बाकीचे सबंद देशान हे लागू पडटले. आमचे बरोबर आसा आमचे ऑनरेबल मेंबर ऑफ द पार्लमेंट श्री सदानंद तानावडे जी. तुमकां खबर आसा की ही इज नाव ऑन द बोर्ड ऑफ पॉलिसी डिसिजन्स. सो तांचे आमच्या बरोबर आसप इज व्हेरी इम्पॉर्टंट. आमच्या बरोबर मॅडम आसा हू इज चेअरपर्सन ऑफ द कमिशन ऑफ गव्हर्मेंट ऑफ इंडिया फॉर अलायड हेल्थ सायन्सीस. आणि अगेन शी इज अ लेडी फॉर पॉलिसी डिसिजन्स. आणि आमच्याकडे बाकीचे एक्सपर्ट्स आसा. अँड खंयच्या रिसर्चाक एकाडेमिशियन आसप इज इम्पॉर्टंट. आणि वी हॅव अकॅडेमिशियन्स फ्रॉम सम ऑफ द टॉप इन्स्टिट्यूट्स. सो दे वील हेल्प अस in creating this new research.
So, कितले कॉलेजेस किंवा मेडिकल कॉलेजेस पार्टिसिपेट झाले या?
Total colleges
45 institutes have participated and approximately 1300 delegates are there, students as well as the member delegates are there.
फिजिओथेरपी आणि चडशा लोकांक न्ही हेजेर कन्फ्युजन आसता. ते म्हणटात कित्याक दोन प्रकारचे स्पेशलिस्ट आसात. फिजिओथेरपी इज फॉर एक्यूट इंजुरीज. म्हणजे आतांच कोणाक इंजुरी जाला, आतांच कोणाक ऑपरेशन केला आणि यू वॉन्ट टू मेक हिम नॉर्मल पर्सन. सो देन यू गिव दिस पेशंट टू फिजिओथेरपिस्ट. ऑक्युपेशनल थेरपी इज लॉंग टर्म सोल्युशन फॉर युअर डिसेबिलिटी. म्हणजे you go back to your occupation. That's why it is called as occupational therapy. Like we have seen so many people earlier when Judy was there, people who are completely paralyzed. We used to teach them to make some candles and all at home to earn their livelihood. So it is related to the occupation. It is related to earning your bread and butter. Whereas physio is making you fit. That's why physio is advancing in something like sports physiotherapy, this physiotherapy, that physio. So people, the cricket team physiotherapist, AMSO cricket team, is much richer than me. So you got the message? Physiotherapy and occupational चडशा लोकांनी हेजेर कन्फ्युजन आसा. ते म्हणटात कित्याक दोन प्रकारचे स्पेशलिस्ट आसात. फिजिओथेरपी इज फॉर एक्यूट इंजुरीज. म्हणजे आतांच कोणाक इंजुरी जाला, आतांच कोणाक ऑपरेशन केला आणि यू वॉन्ट टू मेक हिम नॉर्मल पर्सन. सो देन यू गिव दिस पेशंट टू फिजिओथेरपिस्ट. Occupational therapy is long-term solution for your disability. म्हणजे you go back to your occupation. That's why it is called as occupational therapy. Like we have seen so many people earlier when Judy was there, people who are completely paralyzed. We used to teach them to make some candles and all at home to earn their livelihood. So it is related to the occupation. It is related to earning your bread and butter. Whereas physio is making you fit. That's why physio is advancing in something like sports physiotherapy, this physiotherapy, that physio. So people, the cricket team physiotherapist, AMSO cricket team, is much richer than me. So you got the message?
For allied and healthcare professions, this is a commission which is a regulatory body for occupational therapists also. It is covering a 57 allied and healthcare professions in all so far. So, because being a regulatory body, I am invited here, and this occupational therapy is very essential as far as quality of life to a person is concerned. And each and every healthcare profession has its own importance. So it cannot be demarcated. It's a teamwork, right? So this occupational therapy, the theme is so special in the sense translating research into policy and clinical practice, which means it's an evidence-based practice, which is very much important. And this 1300, gathering of 1300 is a really very big number. And on one platform and exchanging this knowledge and expertise, that will take occupational therapy to a next level. And you know, as Sir rightly said, our Honorable Prime Minister Sir is always worried about healthcare aspect, and this is going to be a very huge step as far as quality of healthcare of this state is concerned. And even, you know, so many speakers from outside India, they have come and they are sharing their expert knowledge. And I was attending one session which was in Abu Dhabi, and yes, how to assess a person to be fit for driving a license. If a person becomes handicapped, whether he can drive a vehicle or not, it is about his safety and safety for others. So for that, very nicely he explained how to assess it, and what detailing and what kind of expertise he had shown, which shows the importance of that profession. So you know, if somebody's life is in their hand, it means a lot. So as far as healthcare part is concerned, occupational therapist plays a very important role. Thank you.
25 आज हांगा इनॉग्युरेशन जालें. ऑल इंडिया मेडिकल कॉलेजीस वेगवेगळे तातूंत पार्टिसिपेट आसा, स्टुडंट्स आसात. आनी जशें आतां दोतोरान सांगलें आमकां, आमचे गोवा मेडिकल कॉलेजचे डीन डॉक्टर बांदेकर, आनी तेणें आमकां सांगलें की कशा पद्दतीन ताचो आमकां यूज जातलो ऑल इंडिया लेवल. आनी त्यामुळे देशभरांतले एक्सपर्ट्स जे आसात ते आज हांगा आसा. 3 दीस हें कॉन्फरन्स चलतलें. आज फाल्यां आनी आयतारा दीस ताचो समारोप जातलो. आणि त्यामुळे हाचे वेगवेगळे आयडियाज जे आहात ते हातूंतल्यान एकमेकाचे शेअर जातले. आणि त्याच्या भितर देशभरांतल्या कॉलेजचे स्टुडंटूय आयला. त्यांच्याच आतां आमी एक एक्झिबिशनूय तांचें उद्घाटन केल्लें आसा आनी थंय नवीन आयडिया ज्यो आसात त्यो तातूंतल्यान एकमेकाक कळटल्यो आनी जशें दोतोरान सांगलें की ताचो गोवा मेडिकल कॉलेज म्हणूनय आमकां ताचो फायदो जातलो आनी त्यामुळे सुरवाती पासून जर पळयलें आसत जाल्यार दोतोरान जो उल्लेख केलो की हांगा सुरवातीक गोवा मेडिकल कॉलेजान जी काम करपी ती हांगा आसात आनी त्यामुळे कशा पद्दतीन ताचो यूज करपाक मेळटलो मेडिकलच्या हातूंतल्यान तें एक बऱ्या तरेचें हांगा वेगवेगळे कॉन्फरन्सीस स्टुडंटाक मार्गदर्शन हें जातलें आनी देशभरांतले व्हडले व्हडले एक्सपर्टी जे आसात ते हातूंतल्यान भाग घेतले आनी एक बऱ्या तरेच्या हातूंतल्यान वातावरणान हें हांगा सुरू जालें आनी गोंय आमचें धाकटें जरी आसलें जाल्यार सगळ्यांक एक गोंयाची क्रेज आसा आनी गोंय म्हणटकच उपस्थिती ऑलमोस्ट जितले आसात अपेक्षा तितले ऑलमोस्ट म्हाका दिसता 95-100% इज ओवर क्रावडेड कॅपॅसिटी ऑफ कला अकॅडमी जर पळयली आसत जाल्यार त्याच्या पेक्षा बरेच दोतोर किंवा स्टुडंट जे आसात ते भायर उरले आसात कारण गोंय म्हणलें की सगळ्यांक दिसता की येवं जाय आमी म्हणून आनी त्यामुळे OTICON 2025ची येजमानपद हे आमच्या दोतोर जे आसात गोवा मेडिकल कॉलेज आनी बाकीच्या तांच्यांनी घेतिल्लें आसा जशें मॅडम शुक्ला जी आसात डॉक्टर वाजपेयी जी आसात हे ऑल इंडियाचे इंचार्ज आसात आनी बाकीचे डॉक्टर्स ज्यांचो ह्या क्षेत्रा भितर स्वतंत्र अशें स्वताचो सहभाग आसा आनी तातूंत वेगवेगळे जे हे आसा ते कशा पद्दतीन फुडें वचूं जाय जे थिंक टँक करणारी पूर्ण टीम आसा आनी त्यामुळे आमचें प्रायम मिनिस्टर नरेंद्र मोदीचें जें विजन आसा हेल्थाचें आनी त्यामुळे हे प्रत्येक गोश्टी भितर उजळ दोतोरूय म्हणटाले की एक बरें खूब जाणांक दिसतालें की वेगळ्या पद्दतीचें फुडें वचूं जाय आनी तशा पद्दतीचें देशा भितर हेल्थ सॅक्टर सुद्दां आज फुडें वचत आसा आनी पूर्णपणे आमचे हेल्थ मिनिस्टर नड्डा जी आसत गोंया भितर आमचे विश्वजीत राणे जी आसत गोंयच्या मेडिकलाच्या संदर्भात ते सगळे काम करतात तेन्ना हांव तांकां सगळ्यांचें कॉंग्रेट करता आनी खास करून सगळे दोतोर जे आज मुद्दम ह्या 3 दिसांच्या कॉन्फरन्साक गोंयांत आयिल्ले आसात त्या सगळ्यांक हांव अभिनंदन करता आनी बऱ्या तरेचो तातूंतल्यान एक नवीन कशें आतां कॉन्फरन्स जेन्ना आसता तातूंतल्यान नवीन कितें तरी भायर येता कारण वेगवेगळे आयडियाज जे आसात हे सगळ्यांचे आयडियाज एकत्र येतकच एक विजन जें आसा विजन फुडें व्हरपाक जाय तें तांच्यांतल्यान भायर सरता आनी त्यामुळे आमचे डॉक्टर बांदेकर हे पूर्णपणे बिजी आसून सुद्दां हातूंत इंट्रस्ट घेतात आनी हें काम फुडें व्हरपाक फुडें पळयतात सगळ्यांक हांव अभिनंदन करता आनी खास करून म्हाका आज त्या कार्यक्रमाक चीफ गेस्ट म्हूण आपयलो आमचे मंत्री विश्वजीत राणे येवपाचे आशिल्ले पण कांय कारणांक लागून लास्ट मिनीट ते पावले ना आनी त्यामुळे चीफ गेस्ट एक एकदां म्हणटा की दाने दाने पेले काय खानेवाले त्या प्रमाणे म्हाका मेळ्ळें पण म्हाका खूब बरें दिसलें कारण कशें जाता की ह्या फिल्डा भितर बरेचशे गोश्टी आहा ते शिकपाक मेळटा आनी आमी पार्लिमेंट सेशनानूय कांय गोश्टी ह्या संदर्भांत ते उलोवपाक मेळटा म्हणून हांवें तांकां सांगिल्लें आसा एखादें स्पेसिफीक जर कितें आसत जाल्यार डेफिनेटली त्या संदर्भात आमचे डिमांड्स वा ग्रँट्स आसता त्या वेळाचेर हांवूय उलयतलो आनी त्यामुळे कारण एक बरी सुविधा आनी प्रायम मिनिस्टर नरेंद्र मोदीचें गव्हर्मेंट जें आसा तें ऑलवेज पॉझिटीव इन दिसता तांकां खूब आवडटा इनोवेशन्स आनी त्यामुळे तातूंतल्यान एखादी बरी गोश्ट जर आसत जाल्यार डेफिनेटली फुडें व्हरपाक असो तुजी सपोर्ट करता थँक्यू व्हेरी मच